All right, so my name is Rachel Steckel, and my topic is the dangers of nurse incivility. Our objectives are safety and quality issues regarding nurse incivility related to patient safety, gaps in leadership, financial and healthcare policy, solutions to fill the gap, nursing theory, and I'm going to cover Phil Barker's title model of mental health recovery. um, Change theory, covering lower change, um, Lewin's change theory, I'm sorry. And then leadership theory, which I'm going to cover the transformational leadership theory, and resources needed to make a change. Okay, so nurses eat their young. So this is kind of a phrase that is talked about through nursing, and it's pretty well known, but what does it mean? So the statement refers to nurse incivility. And so nurse incivility refers to bullying, violence, and destructive behavior targeted to nurses by other nurses. And this can be not only from nurses, it can be like from patients, just any, even physicians, but largely nurses to nurses. And so nurse incivility affects new nurses, the workplace, and the health of patients. Uh, and it's a really important issue to talk about because awareness of this issue is crucial to ensure safety and well-being in the workplace. And it's really also important to mention that this issue has been found in many different countries all over the world with varying rates and has been happening for over 100 years. And so it's really important because incivility causes a decline in patient safety. And that's the main objective for nurses to achieve, So stopping nurse incivility will lead to a better, more supportive nursing practice. So that's kind of the goal. Why is nurse incivility a problem? So, like I already said, incivility causes a decline in patient safety. So there's research correlating nurse incivility and the decline of patient safety competence. And we want to address this issue. And so workplace violence also leads to decreased job satisfaction and increased work absences. And incivility, along with workplace stressors and heavy workloads, can attribute to a hostile, unethical work environment. Um, so we want people to feel safe in the place that they work, especially when the main objective of being a nurse is to help others and help them go through whatever they're going through, and we can't accurately do that when we ourselves are attacking each other and not taking care of ourselves in the right way. So the gap in nursing management and leadership related to entry-level nursing. So the workplace violence leads to reduced workability in nurses, increased job demands, and managerial inequity correlating with impairment. So this means that the negative behavior produced by nurse managers and coworkers regarding nurses leads to errors, preventable mortality of patients, and the overall morale of the workplace. And so, especially with managerial inequity, we want to think like, especially if this nurse incivility is coming from the nurse manager, it's kind of like picking sides, or picking favorites almost, you can't pick and choose who you, like, wanna be nice to in this world, at least in the workplace, especially with nursing because, that's not the goal. You have to be able to care for patients and, you wanna care about other people too, especially if they're coworkers, you don't wanna, cause any harm to them. And so, and also it doesn't even just start with, in the workplace. So nurse incivility from nurse educators has been recognized as a factor that impacts the psychological, social, and physiological well-being of victims, bystanders, hospitals, and the nursing profession. So, sometimes even nurse educators or preceptors can be mean to students, and that also really impacts nursing as a profession because, if you're gonna belittle students from the start of their career, what is that gonna have towards their career? Um, if you go into the profession and think, oh, people are gonna be mean, and then, when you get older, you might do the same thing, we wanna end that. We don't wanna keep that cycle going. And so, nurse incivility actually contributes to a high turnover rate in new nurses, new grads within the first 2 years. And so, another study reports that 72% of new nurses have experienced bullying in the workplace within the first month of working. You know, this is not something that we want to continue. You know, we want if we want nurses to stay in the profession and, people are always going to keep getting sick, we need to be able to take care of these people. And if these people are going to be mean, then we're not going to be able to accurately take care of others. I think something else important to mention too is even just witnessing disruptive behavior decreases confidence and instills fear in nurses and raises anxiety. So, in turn, that's going to affect a nurse's performance and negatively affect patient outcomes. Because if a nurse manager is being mean to somebody, like an employee, and even if it's not you, uh, you might see that and be like, oh, I have to stay away from them. They're not going to help me. And, in this profession, we want to be able to help others and try to do what is best for patients and the team and just everyone. So, implications of safety and quality issues related to nurse incivility. Um, some safety and quality issues that are encapsulated in nurse incivility include workplace safety issues, medication errors, personnel shortages and burnout, health equity, and a lack of quality nursing care. So, workplace safety issue. First of all, there is research correlating nurse incivility and the decline of patient safety competence. Um, and so, like, why? Like, if you're being belittled in a job, maybe you're clouded by what's happening in your personal work life. Maybe you're too focused on that and you know, you got to take care of yourself first. You know, it can cause a decline in patient safety because maybe you're so clouded by everything else that's happening on your floor maybe. Um And so, yeah, and then there can also be medication errors, and they may arise due to incivility clouding a nurse's mind, creating negative patient outcomes. And so, incivility, along with workplace stressors and heavy workloads, can attribute to a hostile, unethical work environment. And, like, let's think about that more. Like, you know, maybe like somebody's yelling at you because you're taking too long in the medication room, and you get the wrong meds or the wrong dose, and that can be really lethal for a patient. We especially if it's something, like a cardiac med or like insulin or something, we wanna make sure, like, that we're doing the best for our patients. And so nurse incivility can lead to personnel shortages and burnout. Um, so workplace violence leads to decreased job satisfaction and increased work absences. Uh, and so nurse incivility contributes to a higher turnover rate of new nurses, new grads, and they usually quit within the first 2 years. And you know, increased work absences. Why would you want to work with somebody that's constantly belittling you? You don't want to put yourself in that position, and that in turn creates bad outcomes for patients, especially if so one nurse doesn't call or calls in because she doesn't feel safe in her workplace. And that's going to cause more stress on the other nurses that are there, and you know further make negative patient outcomes because there's not a proper nurse to patient ratio. Nurses are getting overstressed, you know so we want to be able to really care not only for our patients but each other. Um and nurse instability contributes to a higher turnover rate. We don't Why is that? Like, we want to keep nurses in this profession. Like I said already, people are always going to be sick, and we have to be able to keep nursing going as a profession and do it the right way, really care for people. So, health equity may arise to patients due to nurses being uncivil to patients, or even nurses being uncivil to each other, causing patient safety decline. Um, and nurse incivility from nurse educators has been recognized as a factor that impacts psychological, social, and physiological well-being of victims, bystanders, hospital, and the nursing profession. So workplace violence leads to reduced workability in nurses, increased job demands, managerial inequity correlated with impairment. Um, we really don't want to put people in harm, and uh especially if we have this nurse on nurse crime, it's not gonna look good. It's like, if you are a patient and you overhear your nurses arguing together in the hallway about something, and they're being uncivil to one another, how are you gonna be feeling as a patient? Are you gonna trust them? Um, and also with this, like, how are you gonna be treated by not even other nurses, but maybe physicians or other disciplines, they're gonna recognize that, this is happening and consequences are gonna happen. And so I think it's really important to realize how we treat each other, and, what the implications might be for that. And so my nurse incivility position. So nurse incivility is a large issue that is seen almost every day. And even from my own experience, I've witnessed many experiences where nurses have been cruel to one another or not willing to help one another. Um, and so I've even witnessed preceptors and nurses not being kind or helpful towards students, and that's not very nice, like, especially as a student, we we don't know everything. We wanna we're in this to learn, and you shouldn't belittle somebody just because they don't know something. It's a learning point. You learn something new every day. And so, where the objective of a nurse is to provide safe and appropriate care, it's not appropriate to be mean to one another and not help. Um, and you know, this like I said earlier, this doesn't just stop with you know, nurses just being mean to each other, this can happen from patients too, like I've had some patients, where I didn't really like the way that they were speaking to me, but I didn't let that affect my care towards them, but it's still something to report and it's still something to talk about because, you know, of course you want to help people, but you don't want to be belittled by others or by patients, by preceptors, by your manager, you want a good experience in your career. So financial implications related to nurse incivility. So nurse incivility can cause many financial problems. Like we said, nurse incivility leads to decreased work competency and patient safety errors. Um, so with increased patient safety errors, that leads to an increased amount of adverse effects in patient care, leading to increased cost that that the hospital is responsible for. And if nurse incivility continues, patient safety competence will continue to decline and issues will arise from it. So stopping nurse incivility will lead to increased patient safety competence, which will benefit the hospital from having to pay for adverse effects. So further on that, let's think, maybe, you have to roll a patient or you have to get a patient up to go to the bathroom. So if I had to get a patient up to go to the bathroom and um, you know, I can't find a lift, uh I ask everybody, they're not helping me, and then I try to get that patient up on my own because they have to go to the bathroom really bad, and they fall, you know, then they might suffer from, a broken hip, a broken leg, whatever, and that's going to cost the hospital money because that happened at the hospital stay. And even if nothing bad happens, maybe even they don't get injured, the patient doesn't get injured, that's still a report that you have to find. That's still an incident report. And so it's still gonna negatively reflect the hospital. Secondly, another example is medication errors, like I already said, like maybe somebody yelling at you in the med room, to hurry up, you don't have enough time, you're rushed. You give somebody the wrong medication, the wrong cardiac med, and they have some serious um the patient has some serious issues from that, because you gave the wrong med, but you were under pressure. Um we don't want that to happen. That's going to cost more money for the hospital. It's going to cost for more stress, especially like dealing with something like a medication error, you could lose your license because of that, and you don't want to have to deal with that because somebody was yelling at you to hurry up. If that's the reason, we want to be able to not have to put up with that. So nurse incivility and the nursing meta paradigm. Oh, so the nursing meta paradigm includes person, environment, health, and nursing. And so person is referring to the patient's physical, social, spiritual, emotional, and social needs. So nursing incivility causes a decline in patient safety competency, decreasing the ability um, for a nurse to treat a patient's physical, social, spiritual, and emotional needs accurately. Um, and so you know, we need to be able to treat these people for what they come in for and, even beyond that sometimes. And so an environment includes a person's surroundings, which can include interactions between friends, family, and community. And nurse incivility can contribute to a hostile, unethical work environment. This affects how nurses talk to each other and affects the organization as a whole. And like I said before, like, imagine you being a patient and you hear people in the hallway arguing and they're nurses or like a nurse and a physician, a nurse and a nurse manager, you know, and it doesn't sound like a nice conversation. How are you gonna be treated as a patient, Like how, you know, you see how other people treat each other and you're like, so how is this gonna end up for me? As a patient, you gotta think about that. And then also like even with physicians, like, if this nurse incivility is happening like in front of a physician or something, and then it's just like it creates a system of distrust. And we don't want that, especially in the healthcare field, because, we really want them to trust us in order for them to accurately get treated, and, so we can try to help them. And so health depicts the change in health and well being throughout a patient's lifetime. And so nursing incivility affects the health and well being of a patient's lifetime, Um, you can if it's not if nurses are being mean to each other and that's clouding their patient safety competence, especially, maybe they're not accurately listening to a patient, and that's going to affect their health, you know, especially if what they're saying isn't being considered and they it negatively impacts them. Maybe, they get the wrong medication or something, things are preventable, and sometimes we don't know until we don't know. Um, and so nursing is considered everything learned in the school and the field. And so nurse incivility affects how nurses learn in the field and how they will treat each other nurses later on in their career. And so, especially back to um what we talked about earlier, how nurse incivility really actually starts in nursing school, and nurse educators have a big impact in this, in the nursing profession. So that's school. And especially when you get into the field, nurses either young. Um, so older nurses are being mean to new nurses, so much so that a lot of them are quitting within the first 2 years, you know? Um, and then even more so, a lot of the people that go forward and, even if they've experienced some incivility and instills some fear, um, and it takes a toll and it raises stress levels and increases emotional exhaustion. Um, and so it's just not a good situation, we don't want uncivil behaviors to affect employee turnover rate and like staff morale, we want a good work environment for the sake of patient safety. Um, so nursing theory and nurse incivility. Sorry to go back, but just another thing to add is so even if new nurses aren't quitting within the first 2 years, a large of them might just stay in the profession, but they'll start to engage in avoidant behavior. And so this is from occupational burnout, and it negatively affects the nurse's behavior and morale. And we don't want people to be avoidant, especially like with patient care. We have to be in the right mind to really help other people. And especially with students because we don't have a professional attitude yet, and with absence of encouragement, students may be resistant to keep going in the nursing profession, especially when experiencing emotional distress and becoming avoidant, and we don't want that. We want to keep people in the field. All right, so back to nursing theory and nurse incivility. So, the nursing theory that applies to nurse incivility is Phil Barker's title model of mental health recovery. And so the values of the title model are revealed in the 10 commitments, which are respect the language, develop a genuine curiosity, become the apprentice, use the available toolkit, craft the step beyond, give the gift of time, reveal personal wisdom, know that change is constant, and be transparent. And this applies to nurse incivility because it offers support to the idea of facilitative communication, sharing wisdom, and empathizing with others. So let's just look at that more. Maybe somebody says something mean to you. Okay, so why are they saying something mean to me? Let's think about this. What are they going through? Like, you know, um, or we gotta be able to talk about things so that way we can effectively come to a conclusion. Like, how do we make things better? We have to respect our language. You try to say things in um a professional way. Develop a genuine curiosity. We want to why is this happening? Why are things going south, not the way we want to? Like, how can we fix this? Um, and so we, like, especially with patient care, we want to be able to point each other to the right resources. So, like, Lipton, or, I don't really know that. Maybe you should look it up on Lipton, um, look up the protocol, um, craft this step beyond. I don't really agree with that protocol. Maybe I should look up some other, um, maybe I should look up Lipton, or maybe I should look up other policies. See see what's up. Are we doing the right thing here? Give the gift of time. Um, reveal personal wisdom, and know that change is constant. Right, because we wanna change things for the better, and we wanna be nice to others, and you know, we're not here to tear people down. We're here to build people up, you know, not only our patients, but each other. We can't do that in the profession. And we need to be transparent with our motives and what we want to do, especially with patient care and especially with each other. Okay, so Lewin's change theory. So this applies to nurse incivility. And so step one is the process of altering behavior to unfreeze or agitate the status quo or the equilibrium state. Um, so step one is necessary if resistance is to be overcome and conformity achieved. So step two uh, involves movement of the employees to a new level of equilibrium, and it helps employees to view change from a new perspective, to work together to achieve desired outcomes of change, and to facilitate consistency among management and employees. Step three is refreezing or attaining equilibrium with the newly desired behaviors. And so step three occurs after change is implemented so that new behaviors and desired outcomes can be integrated into the organization. Okay, and so how it is applied to nurse and civilian. So step one, back to it, we're altering the behavior to unfreeze or agitate the status quo. And so we need to agitate the status quo, that nursing incivility is a rite to passage. Okay, and so the second step is to change, and it involves movement. So the change that needs to happen is for nurses to be more accepting of one another and to create two-way communication that encourages understanding and cooperation. Um, and so the third step is to refreeze or attain equilibrium, of the newly desired behaviors. And so uh, the refreezing, specifically, is when two-way communication should be the new normal to facilitate cooperation and understanding in the workplace. And, this is really important. We want to make sure that people are understood, you know, like, why do you have an issue with this person on your floor? Oh, we want to be able to address things, in a professional way to make things better for the workplace and for nursing as a profession and patient outcomes. And so transformational leadership theory. So this theory emphasizes the importance of interpersonal relationships, and it focuses on the motives, desires, values, and goals of both leaders and followers to find a common cause. So, the goal of the leader is to encourage staff members to commit to the vision of the organization rather than as an individual. And this applies to nurse and civility because the goal is to transform the ideal of being negative towards one another to improve the morale of the organization or a unit as a whole. Right. So, like, we don't want to, we want to encourage staff and others to be nice to each other, and really get to the bottom of why things are happening, and maintain a professional attitude and try to really encourage one another. So, resources needed to decrease nurse incivility. So, we need a lot of social support from peers and colleagues. That's really important to ensure nurse and patient safety and to improve staff morale. We also need to look at zero tolerance policies. So, zero tolerance policies also need to be reassessed because nurses will often tolerate small events, and in turn, it can reduce a nurse's confidence. In addressing violence. So, like, if somebody says something to me, like, maybe like somebody's being mean, like somebody calls you stupid, and then you're like, why are you saying that, And then maybe you tolerate it, you don't report it, and then things will get worse. It's like building blocks, Um, once you tolerate one thing, the next thing will happen and it's going to be worse. And, we want to address things even if they seem small. We want to make sure that anything violent or any like thing of bullying, is reported. We want to make sure that people are okay. Um, and so rather than confrontational model, like addressing violence, managers should create a two-way communication system to facilitate understanding and cooperation between nurses. We don't want to tattle either, we don't want to say, oh, this person's being so mean, blah, blah, blah. We want to be able to make sure that things go back and forth and, that, people are understood for like their actions and what happens, we want to make sure that like even if you did something wrong or said, we want to address it, to make sure that you don't do it again or so that that, you know, like just be more kind and understanding to others on the floor or whatever the issue may be. Um And so nurses should also receive assistance on workplace and violence from the administrative level, including full institution and executive support of nurses following workplace violence and events, and reward nurses for their dedication. And something else, so nurses should be taught coping strategies to tolerate and mediate psychological violence, and we also want to promote the intolerance of physical violence from patients to promote nurses' mental resilience and reduce damage done by workplace violence. I mean, not only by patients, but nurses as well, you don't want to have to deal with any kind of slander or assault from anybody in the workplace, that's just not some place that you want to go, or where you might feel accepted, that's not really cool. Um, and so, yeah, we just really need to make sure, we are kind to each other. And, it's really important to bring this up to managers too, because we need to increase managers' awareness of potential incivility in the workplace and documentation with like good, possible disciplinary action, to help decrease incivility, maybe not severely punishing people, but, you got to know, especially in this profession, you gotta know how to treat people, and if you're not treating people right, then how are you gonna treat your patients right, It's just you gotta you gotta know, and it's really important too because you know, like nurse incivility doesn't even just affect nurses. I mean, but like as a group, nurses are reportedly the highest exposed healthcare professionals to experience uh uncivil behavior. But nurse incivility can even cause clinicians or physicians to seek new positions because they're so upset, or by the fact that nurses are being mean to each other, and nurses are very vulnerable to verbal abuse from colleagues and other people, it's just not cool. And so nursing role to stop nurse incivility. So the nurse's role at the entry level to achieving resolution to this identified disparity or complex problem follow. And so we want to maintain a professional attitude, work is work. And then we want to follow evidence-based practice. So we want to do the best thing that we can do. We're not doing anything willy-nilly. We're going by the book. Um, we want to have two-way communication to facilitate understanding and cooperation between nurses. We can't work well if we're fighting, we want to be able to have a civil conversation with each other. Try to have peer support and strong social networks. So, even if you're having issues with people at work, try to settle those issues and differences, have good peer support that like you can go and rant to, or like maybe not even peer support if you don't feel comfortable with that, like like even somebody professional, even a therapist, or you need somebody on your side and somebody to talk to about like issues that you're facing, especially in the workplace, because you're going to be there a lot, it's work. And so we also want to report workplace violence, like I said, even like the small stuff, we want to be able to uh have things be taken seriously, and you know just address issues. And so this is also really important because, if left unnoticed or unchanged, incivility can travel through the entire organization, negatively impacting the workplace environment and patient outcomes. Like I even already said, um, nurse incivility can cause like a lot of clinicians to quit, or a lot of nurses to quit within their first 2 years. We don't want this to continue for people to quit or people to leave. It's not going to benefit patients in any way. And so the nursing philosophy in alignment with the nursing meta paradigm and how it is applied to nursing civility. So the role of a nurse is to alleviate discomfort and the suffering it gives rise to, and that can't happen when nurses are inflicting pain on one another. And so the nursing philosophy outlines nurses' ethics, and it is unethical to cause harm to one another. This harm can arise between nurses and then patients as well. So the nursing philosophy also covers motivation for being part of the profession. And if nurses are bullying each other, then it decreases a nurse's drive to stay within the field. And so nursing civility causes or contributes to a high turnover rate um, in nurses within the first 2 years of graduating. And, we want to keep people in this profession. That's not why we're here. We're here to take care of other people, uh, not to drag each other down. And so, in conclusion, we really, as nurses, the role of a nurse is, like, once again, is to alleviate discomfort and the suffering it gives rise to. And, we can't do that when we're inflicting pain on one another. And nursing civility causes a decline in patient safety. And that's the main objective for nurses to achieve. If we're not doing the right thing for our patients, then what are we in this profession for? Um, like, also, how can we, as nurses, expect respect from patients and clinicians when we're not even giving respect to each other? You know, uh, we want to be respected in this field, and we want to be taken seriously, and not only for our sake, but for the patient's sake too. We want the patients to take us seriously. Like, you know, we try to educate patients on what is right or wrong for their health, like don't eat too much salt, you're on a fluid restrict. We want those are simple things, but we want them to trust us, you know and we want them to respect what we're saying and trying to teach them because it's going to better their health. But if we're not even respecting each other, then that's kind of hard to do. Um and so, nurse incivility, like I said, has been seen as kind of like a rite of passage. You kind of have to be bullied to be in this profession. And that is not right. It shouldn't be seen as a rite of passion. And it shouldn't be the reason why most nurses quit within the first 2 years. We don't want nurses to quit. We don't want new nurses, 73% of new nurses to experience bullying within the first month of working. That's not right. And, even before that, like I said already, with nurse educators, or preceptors, we don't want to be belittled by older nurses, when we just don't know. We need to be here to help each other. And so measures to stop nurse incivility should include communication that encourages understanding and cooperation. And, we want to encourage other nurses to share their feelings about incivility that's happening. And, it's really important to have social support from peers and colleagues to ensure nurse safety and patient safety and to improve staff morale. We want this to be a good place to work. We want patients to trust us. We want to trust each other, to do better for the workplace and for patient outcomes and to have a good nursing career. And so the most important thing for hospitals to acknowledge that incivility is happening, and to ensure that interventions to stop bullying are implemented. And, like we talked about the zero tolerance policy, we also want to go back and look at that. You know, we want to make sure, that this kind of incivility and bullying is addressed, and, we're not going to handle it. We need to be here for patients, and their better safety, and once again, we can't do that if we're being mean to each other. Um, and that's the end of my show. Thank you for listening. Here are my references, and I hope you have an amazing rest of your day.